The vision is, what would you want for your future? Now, if I go out and ask older people now, they will say, I want to live at home. And I say, yep, so do I. And if I say to them, where do you think you'll be when you're 90? They nearly all say, in a nursing home. And I'm saying, why? You've just told me you want to live at home. The human race at the moment, the Australian human race, is bamboozled into thinking it's all going to end up in a nursing home because that's what we've done for 100 years. And we've been taking people out of society and putting them out of sight, out of mind for 100 and something years. In the old days, it was the right thing to do and everyone was grateful to be there. What bothers me is we're still doing it without asking why we're doing it. We're doing it in a very beautiful way because people live in these facilities and they're really nice and they're empowered and all the rest of it. It's still not home and we're still doing it. Why are we doing it? Well, because, they can't manage at home. But why can't they manage at home? And once you start asking a few whys and keep driving the why, I think you end up... What I would like when I am old is to live in my own place on the terms that I want. Doubtless when I'm 90 I'll need a bit of help, that's fine, but on my terms. What worries me about the future of aged care in Australia is that it's in the care health bucket and it needs to be in the living bucket, because if we keep providing care to people in their own homes, and a lot of that's being done these days, and we get smarter and smarter and we have to use a lot of enabling technology because we're going to run out of people. Well, we're still going to have people, but we're not going to have enough to do the whole lot. We're going to end up with old people who are dying of boredom and depression because they're sitting in their own homes. What we have to do is build communities. The future of aged care for me is building communities so that old, young, black, white, female, male, disabled, ordinary, clever, not so clever, everybody in the community, in all its diversity, is participating in making that community a good place to be. So that those who need a bit of help get a bit of help, and those who can give a bit of help, give a bit of help. A community where people can walk to the shops with their wheelies or their pushers with kids in or whatever it is. A community where everybody at least knows a little bit about everybody else, so that if the old lady doesn't appear for 3 days, somebody goes and knocks on the door and finds out why. We've left that village mentality, and until we can bring that back, any amount of care is not going to make an old person's life any happier. And depression is very common in old age. And the rate of suicide in old men, the rate of suicide, is as high as the rate of suicide in young men. It's scary. And the big sleeper for me in aged care, we can do wonderful care, but if we haven't built a community where people look after each other, I guess, ultimately, people will go into nursing homes because they're a community.